has been a good experience working in this mission, because as you know, this is mission work, and as a missionary, as a medical missionary, when we go to fields like this, because we just finished one in September, but coming to this place, Oniyanmo village in Ogun State, it's another experience. But people, sometimes I met with people that I will call patients. You see, their problems or their health needs, it will be able to meet them with the drugs that we have on ground. But some with their complaint due to the drugs we have on ground, we won't be able to meet them, yes, to attend to them. But I will definitely write some prescriptions for them. Go get these drugs, buy them. If I'm still going to stay like 2-3 days in that place before leaving, I will tell them that I prefer that they will get those drugs and come and show me before they will start to use it. Because when they go to some chemist, they will take the advantage that because they know nothing. What they ask for, they don't know it. But the chemist will just give them what is available. And it's not what I wrote. Substitute. And they, ignorantly, they will take it and start to use it. Maybe for themselves or for their children, whatsoever. So I do tell them that, please, just make sure that you show me before you start using the drugs. The common complaint, the common one is body pain. That is the common one. Arthritis. That is
for younger people?
For younger people, like today now. I have some cases that their complaint, I just say, okay, this one is having a queried appendicitis. Someone here too, just yesterday, because this medical outrage, we have been on it since yesterday. Today is day 2 for the medical. So I met a boy. The boy should be around 15, 17 years. He complains to me, and I have to book him on appointment that, okay, in the evening, come later, because I need to examine the boy. And I discovered that the boy is having undescended testes. The 2 testes are undescended. It's up. Even before I was able to even feel it or to touch it, I have to go inside before, but the testes are there. The 2 are there, but they are not descended. The 2 testes. So cases like that, though I have to see the parents of that boy, which I will do today. I have to see them and advise them. This thing need a medical attention. And it is surgery, yes. It's surgery. It's surgery. They will just pull down the 2 testes and the boy will be okay. Here, actually, I would say they have one government health center. But yes, because I came here and I saw one close to Oniyanmo, but the functioning.
It's like not existing.
I'm telling you. I saw it, but I didn't see anything there. I just passed through the place, but I didn't see anything there.
Nobody?
I didn't see anybody. So far, I have attended to 116.
Wow.
And I still have some names that I will add. I think up to like 20 something. But let me say the average together is around 140. 140, 160, yeah. Yes, since we are from Oyo State and this is Ogun State. So like today now, a guy complained to me and I said, okay, this thing should be appendicitis. So I said, okay, you have to go to a hospital. Let them re-examine and you have to go for scan. So it is the result of that scan that will now, okay, show. But what I'm saying now is still queried because the scan have to confirm it So when the scan confirm it, then you are having appendicitis. But with the complaint that the boy gave, I told him that it may be, until when it's confirmed by the scan. So something like that, I just okay, go and see a doctor and let him give you form to go for scan before it can be established that you are having appendicitis. The cost. Wow. It's not easy anyway. And the cost of the drugs, say the actual price may not be, but it's going to around 120. The previous ones, no, but for this one, we haven't done. But for the previous ones, it is helping the church and helping the community. You have people around that maybe this CBS, yes, they are doing it, but they cannot do it alone. They can't do it alone. And the impact of this thing is, all these drugs, many people cannot afford to buy them, and they are sick. It has happened before, and it's still happening now. Many people died because of, based on avoidable sicknesses. That is avoidable. But some are ignorance. Some are poor to that level that they cannot afford it. And some have the money, but they are ignorant. So they need people to synthesize them. They need some orientation. But doing this thing, we open the eyes of many people. Some are even taking drugs that they don't even know the names. And at the same time, the government alone cannot do this work. Government cannot do it alone. So it's like even helping or assisting the government to meet the needs of the people. And I thank God that what we are doing, God is happy about it. Because we are saving lives. On Oniyanmo medical outreach that I've started since yesterday. We started 9 a.m. yesterday. And when we go and when we have gotten to something around 3:30, we have to stop to go and prepare for the crusade in the evening that will start by 5 o'clock. So we have to stop, have a short rest to refresh for the crusade. But people are still trooping in that yesterday. So we have to say, okay, let us extend this day today. That was yesterday. Because some places we have it just for one day. And we will cover everybody. But we are serving people since yesterday. But thank God that we covered everybody today. Based on that, many surrounding villages also benefited from it. Not only people from Oniyanmo. I think I will remember some names that I got. Some names of some villages. Alaga, Reserve, Oniyanmo. I think those are the names that I can remember now. So not only Oniyanmo alone, the neighboring villages also come.